We do know how quickly now we can spin up negative pressure rooms. So that's definitely one of those things we're going to keep in that handbook for the future. Our team, our facilities and construction team came together to more than double the negative pressure rooms we had within our medical centers. So that's one of the keys to keeping people safe, not only our employees, but anyone else in the hospital and the physicians. And then, I think it is the opportunity to look at the alternative care sites and to plan ahead and say, where, if something like this or of this magnitude were to strike again, whether it's this virus or another virus, where are those release valves that we might have in play? I think tents were great, right? Initially, we had tents set up so that we could separate those individuals coming to the emergency department that might show COVID symptoms from those that, didn't and might be there for another reason. They worked in certain situations, but not in others, depending upon temperature and what was going on with the environment. But I think it's all of that. It is also the supply chain, right? Making sure that we are stockpiling to the degree that you can, because of course supplies expire, but making sure that we have readily available access to a variety of supply chain channels to make sure that we're not just relying on one vendor to get us the masks we need, right? That we have a multitude of channels that we can tap into. Same kind of thing on the staffing side, right? Because as, in a variety of situations, you would have different departments that would have staff calling out because they were sick. So it wasn't just the patients coming in, right? We were also dealing with managing short staffing in some cases because individuals had contracted the virus and they couldn't come to work. So it's managing all of the staffing issues, having the ability to float staff to other areas, making sure that we have cross-trained individuals that are capable moving from, a med-surg unit to, a med-surg tele unit, making sure we're doing that cross-training, or having an ICU nurse who's willing to move to a med-surg unit, if needed. And in some cases, we have that flexibility, and in other cases we don't. But I think it is all of those things, and making sure, again, just like you said, the disaster preparedness, manual, handbook, I think those are the things that will make the list.